I'm going to treat this asymmetric smile. So this beautiful patient of mine has struggled with her asymmetric smile and it's really impacted her confidence. You can see here that when she smiles or expresses, that left lower lip pulls down more than the right, which is 5 units of neurotoxin. I'm going to help treat this asymmetric smile and rebuild her confidence. The culprit here is the Depressor Labii Inferioris, or DLI. And this muscle, although it's small, it's mighty, and its function is to pull down the lower lip. And when it's hyperactive on one side, it creates this unevenness. You can see for her, her left DLI is more dominant. It's dominating that smile and creating that uneven appearance. The DLI is a muscle that lies deep to the DAO. It originates at the mandible and inserts into the lower lip. It sits just medial to the DAO. And remember, the DLI is the muscle that we're trying to avoid when we're injecting the DAO, the depressor anguli oris, which is that muscle that pulls down the corners of the mouth. So when we treat them with neurotoxin, the DAOs, you get a little upward tick on the oral commissures or corners of the mouth. So when we're treating that triangular muscle, the DAO, we're trying to avoid the DLI, because if we bleed into the DLI, you're not going to be able to pull down the lower lip. So for her, since that function of the DLI is to pull down that lower lip, hers is hyperactive. So I'm trying to block that function. So I'm going to paralyze this muscle ever so slightly so that she can lift that lower lip and balance out that right side of her lip so that she has a more symmetric smile. So when I target this muscle, what I like to have a patient do is smile and see where she's pulling the most in that left lower lip. And then I'm going to draw out where I think her DAO is. And you could see where I'm drawing it out right now with this little triangle. Just medial to that lies the DLI. And remember, the DLI is deep to the DAO. And then we have the mentalis sitting right central. So I'm targeting in between the mentalis and the DAO. I'm going to use 2 pokes to try to capture it in 2 different areas, and 2.5 units per poke for a total of 5 units. We've done this a few times on her and she's absolutely obsessed with this. She comes in every 3 to 4 months for it, and we just go boop boop and 2 little pokes and it just raises up that lower lip and off she goes. It's something so simple, but you have to be really strategic with that neurotoxin, and it really just helps rebuild her confidence. If you love these videos, please hit the subscribe button. I love recording these videos. I'm almost at 1,000 subscribers and it's been so fun. I'm absolutely obsessed with not gatekeeping and just sharing all of my tips and tricks, including my complications and my mistakes. I'm an open book, so if you have any questions, please comment below.